But have you ever done a scan? Have you gone to do ultrasound for the baby?
Please help me ask her. She said the doctor said we shouldn't do a scan at any hospital until she's ready to give birth.
Unfortunately, madam, I'm really sorry. You are not pregnant at all. With me now, I have our clients for the day. Let's meet them, Mr. and Mrs. Sylvester. You're warmly welcome.
Thank you, Mama.
Welcome, welcome.
Nothing's wrong with you, Abel. Just sit well now.
You see, Ma, this is what I've been facing for the past 1 year. What man does not want to help his pregnant wife?
Pregnant? What are you pregnant? That thing inside you is not even a baby. Who stays pregnant for 2 years? 2 years.
Nurse Ada said that there are cases like this.
Here we go again.
Okay, let's calm down a little bit. Let's calm down. Okay. Mr. Sylvester, tell us what brings you. What is the problem?
Thank you, Mima. For a very, very long time, I've been persuading this woman, begging her literally, let me take you to a doctor. Let's go see a doctor. Let's know what's wrong with you. She said I should give her 2 million. This economy, 2 million naira that you want to give birth. Haba. Ha.
And you've been pregnant for 2 years?
2 years and 3 months.
Hey, wow. Amazing. That's not normal. But why are you refusing to go to the hospital?
Because they instructed that I do not.
Who is she? Who will even tell you that kind of thing? Huh?
Okay, Mr. Sylvester, please calm down. Please calm down. Okay. Madam, who instructed you? Who has asked you to do this?
The hospital that I went to in Aba to take in. They said that their criteria for their procedure is not to see another doctor. Until the delivery date. They checked me themselves.
Okay, so what did they say is wrong?
Nothing is wrong. They just need 2 million and they will get the baby out.
That is nonsense. Any doctor, ask anybody, any doctor is qualified to, and I should pay 2 million naira when I'm not even sure that she's even really pregnant.
Are you the one pregnant? How can I be telling you that I'm pregnant and you're not believing me? Do you know my body more than me? When we were finding it difficult to take in, for 4 years after our wedding, a friend of mine directed me to a clinic in Aba that they do a procedure there and that someone who is barren can have a child. She said that they do both physical and spiritual. And I told my husband about it. And he agreed for me to try it.
Okay.
Right there, they gave me an injection. After paying 400K. The next month, I didn't see my period.
Okay.
And I vomited. I even had cravings. Ask him now. He's here.
Okay. But have you ever done a scan? Have you gone to do ultrasound for the baby?
Please help me ask her. She said the doctor said we shouldn't do a scan at any hospital until she's ready to give birth.
Some cases are spiritual. Have you forgotten how we both tried, even when we were healthy? How do I face your mother and my mother and tell them to return back the baby things that they delivered? Or is it the church? How do I face people?
Wow.
All you have to do is just to be patient, look for the 2 million naira. They're doing us a favor.
What favor exactly?
My point exactly. A doctor is saying she prayed and hid the pregnancy. That is when she's ready to give birth that the announcement will be made that eyes are on her pregnancy. She's the only one that is pregnant.
That's strange. So you're trying to say you've never done an ultrasound in the past 2 years. You don't know what she's carrying.
Never.
But I feel it's in here. I feel the baby kick sometimes.
Oh my God.
all you have to do is just look for the money. Please, ma, help us look for the 2 million naira.
Ma, this is not why I'm here. I just want you to please help me beg this woman. Let me take her to a doctor. I still love this woman. Let me take her to a doctor at least. Let's know what is wrong. Even if she's pregnant, at least it's not unhealthy for someone to have something in her belly for that long. 2 good years. Please help me. Let me save her life. Let me save her life.
Okay. Madam, it's well. But we may need to do an ultrasound. We may need to go to the hospital to see what the problem is. But let's take it one at a time. Okay. At this point, I think it's time for us to take this matter to the Situation Room. Let's hear what they have to say about it before we take the next steps on the matter. Welcome back. You're still watching Lifelines with Mima. With me now in our guest corner, I'm happy to introduce to you Dr. Ifyok Ikpe, who is a specialist gynecologist and obstetrician. He is also the head of the Department of ONG in Nyanya General Hospital. You're welcome, sir.
Thank you.
Thank you for honoring our invitation.
It's nice having me on the show.
Yeah, so this issue is a fairly common one. I've had a lot of women reach out to me after watching the show to say, oh, I've been pregnant for 2 years. I've been pregnant for 1.5 years, and I need 1.5 million to deliver the baby. Where they say we should do it, the hospital, say they are protecting the child spiritually. So if you go for a scan, you don't find the baby in the woman's womb. But she's putting on weight and feeling pregnant. How do we explain this?
Thank you so much for this. But this an issue that, for me, is very, very rampant in developing countries, especially as Nigeria. And there is a medical terminology, what we call phantom pregnancy or pseudocyesis. And also another, in line with that, what we call cryptic pregnancy. Which, for these women, what they do is they go to some quacks, I call them quacks, and they receive some injections, hormonal injections.
Wow.
The side effects of those injections will bring about the symptoms of pregnancy, the breast engorgement, the tenderness, absence of menses, they're not seeing their period, leg swelling, and all those signs that comes with normal, even morning sickness, vomiting. And the abdominal swelling is actually the side effects of all those drugs that they are given. And they'll now have that mindset as if they are pregnant. And they will tell them, don't go to anywhere. It's fraudulent, it's deceitful, and you want to put it the way it is criminal.
Yes,
for
it
you
is.
to go to that extent. And medically, you want to talk about phantom pregnancy. Yes, it's a term that it exists in the medical terminology.
Wow.
And it's when it's a condition that involves the presence of signs and symptoms of pregnancy when the woman is not pregnant.
When there is no pregnancy.
And it's very common in women that are married, very common in women that are within the reproductive age group. That means from 15 to 45 or 49 years, because they're actually looking for babies.
Yeah.
And in our environment, in Africa as a whole, where high premium is placed on giving birth, fertility. So these women will go extra lengths to look for pregnancy by all means. And that is how they fall victim. They are vulnerable to all these quacks in the name of trying to give birth. And what does this phantom pregnancy actually mean? Let me just break it down so that they will understand very well. And pseudocyesis is from a Greek word. Pseudo means false. And cyesis means pregnancy. That is false pregnancy. So actually, they are not pregnant.
They are not.
But they have all the signs. And what can be responsible for all this is the exact cause is not known, but there are some risk factors.
Okay.
And there are some mechanisms that have been put in place so I will understand why. For instance, if there's a loss of a loved one, like a son or the husband, the father, or there's loss of love or the loss of fertility, maybe for instance, a woman has lost her womb through a process. Maybe she did hysterectomy.
Yeah.
That is removal of the womb.
Yeah.
And she's still anxious of having more children. She will go extra mile to to say, yes, I'm pregnant. In the bit of trying to ensure that, I have something to hold on to. The last one, the son, she lost the child, so she's looking for a replacement. So in that scenario, it's more of a psychological condition that the woman is looking for, by all means, to get it. Also, aside from the psychological aspects, there is also medical and surgical condition that can lead to phantom pregnancy. For instance, if there is a tumor, what we call ovarian tumor, that secretes the hormone, HCG, the woman can also have all the signs of pregnancy, but she's not pregnant. And the only way for you to confirm that this is phantom pregnancy, once you do a scan,
you see it. Yeah.
There is no pregnancy that cannot be seen on ultrasound scan. As far as it's above 5 weeks, from 6 weeks, you can see it with transvaginal scan. That is the scan
TVS,
through the vagina.
Yeah.
But from 6-7 weeks, you can see any pregnancy per abdomen. That means what we call transabdominal scan. There is no pregnancy, no matter what. You can see it when you do an imaging technique, ultrasound scan. So they will go out because they know that it's not possible. They will tell them, don't go to hospital. Scan cannot pick it.
We're hiding it spiritually, yes.
Come back to them. And in that particular, they will stay for 1 year, 2 years. And why is it that they must go and deliver in
that same hospital when you can deliver anywhere?
If there's pregnancy, you can deliver anywhere.
Yeah.
So there's something wrong that they are not telling them, and it's because the woman
she's desperate.
They are desperate, and that makes them vulnerable, and that is why they can go extra mile. Because I'm looking for something. So,
doctor, let me ask you: what happens at the delivery? How do they trick the woman to believing she's giving birth? Okay, there is one scenario that happened in Guinea, even though I know there are so many in Nigeria, in the country. It was a case of, that was even herbal concoction. She was given herbal concoction, and she carried pregnancy for 3 years. And she was told, don't go to anywhere, come to our hospital. So when the woman presented, what they normally do, they will arrange a baby somewhere and then keep it for the woman to make the woman believe that truly she gave birth. They will put her under the knife. Wow. Put her under the knife. Wow. Like you are doing a C-section for the woman. And then they will now open. They know that nothing is inside. Oh, God. And then after doing that, they will close her up and they hand over the baby to her. Was coming from somewhere to her. And then she will believe, because the symptoms were there, her tummy was swollen, all the signs and symptoms. So she will believe, I have given birth. Wow. The only way you can do that is if you do DNA test. And how many people can even afford the DNA test? But to shock you, ma, let me give you, most people that go for this particular pregnancy, money is not their issue. Because they pay a lot. It's true. They pay even for the injection to coming back to come and deliver 1 million, 2 million. So, and is because their mindset has been made. So the only way to ensure that they come out from this is to them to be enlightened. Their mindset reorientation that pregnancy, even though spontaneous conception is not possible, yes, there are other viable ways of getting proven method that you can get pregnant. It's IVF, assisted reproductive technique. There's even surrogacy. There are so many. So it's not for them to put their mind on this because they want let people see that I am pregnant. Yes, through IVF, people will still see that you are pregnant. It's your baby. It is. And sometimes, if not, it's even your egg that can be, except it's not, maybe you are both your age on the air, so you can use donor eggs, but at least you are the one to carry the pregnancy. And it's a real baby. There are other ways. You can also adopt, surrogacy and the rest. So it's still your baby. So why subject yourself to all this? Because it's something that even government has to come in. Law enforcement, because for me, it's criminal. It is. That's telling out that it should not be allowed to just continue. Before I close, let me just give an insight as regards cryptic pregnancy. Cryptic means hidden. That means pregnancy is hidden. But that is where most people have it
wrong. The term alone is misleading. Not that the pregnancy is hidden, but because the woman did not or have not accepted that she's pregnant, or did
Didn't
not
know.
recognize that she's pregnant. For instance, if a woman just get bed now and she's still breastfeeding, you can stay for 6 months, 1 year without seeing your menses. During that time, if you have sex, you can be pregnant. And
you
you still
won't
be
know.
thinking, it's the symptoms of the one that you just get bed. And you won't know. You can stay 2 months, 3 months, 4, up to 5 months. But if you do a scan, there will be pregnancy.
You will see the baby no matter
So
what.
it's not really cryptic, hidden. But because the woman did
She's
not
not aware.
recognize, that is why it's called hidden. Cryptic.
Hidden,
Not because you can't see the baby. Also, for instance, people that have menses that maybe you will come see menses this month,
Yes.
3 months, 4 months, they are not seeing it. That also can give the woman may be pregnant and will not know, will be thinking, oh, it's my menses that skipped for 3 months, for 6 months. And that will now is another
Cryptic pregnancy.
Another aspect is maybe the person is on bed pills, injection and the rest, and some will not have menses during
That
when they are
time.
on pills and all those. Also, if they are perimenopause, that means they are close to menopause. During that time, also their menses is irregular. They may see menses this month, 3 months they skip. So those kind of women, they may get pregnant without knowing. So it's not that there's no pregnancy. So critical is really a true pregnancy. We scan, you can identify the pregnancy.
Wow.
So the name itself is misleading, but there is a true pregnancy.
Wow. Thank you so much, doctor. There you have it. For my women out there, I know, because myself, I've been through the rigors of infertility. It is important that we are careful, even in our desperation to have children. There is no pregnancy, as the doctor has said, that cannot be seen with an ultrasound. There's nothing spiritual about it, and it's not possible for a woman to be pregnant for 2 years, 3 years. All of it is a scam, and I hope that our government will stand up to this occasion and make sure that we nip this in the bud before it gets out of hand. So we did a quick run, to the hospital, while we're deliberating in the situation room. They went to the hospital close by to check and do a scan for the first time to know what's going on, right? And you both agreed and consented to, it's okay for us to share the results publicly?
Yeah, sure.
Is that okay?
Yeah.
All right. Unfortunately, madam, I'm really sorry. You are not pregnant at all. I'm sorry. I'm sorry. I'm sorry. I'm sorry. There you have it. Phantom pregnancy scams are everywhere. When anything feels and sounds unusual and abnormal, know it that it is. There's no pregnancy that is ever hidden for 2 whole years. There's no pregnancy that requires that you pay a particular sum of money to be delivered in a special place. I know that these people deceive people a lot. I know that they sell babies. These are the people also running children's factories. And a whole lot is going out there. And this is just a classic case of people that have been scammed. Please, please, please be careful out there. It is not all counsel from your friends that you need to listen to. This is outrageous, and we'll definitely get to the matter of who did this to them. We will surely bring them to book and deal with them appropriately. In the bid to have children, you can see what this family has been through. Let us be kind to one another, because every seed you sow, you shall germinate and reap later in the future. Let's stop stigmatizing against people going through infertility, because sometimes it is you and me that push them into doing these things just to have a child. Every couple has a different timetable, and there's nobody that should give you a standard for what time and how you should become a parent. Please explore. Make sure you do your research. Make sure you go to professionals. Make sure you avoid doing what you cannot explain and what you cannot find evidence about. Please be careful. I hope that you learned something new from the show today, and I look forward to seeing you next time. From all of us here, and until we see you next time, don't forget that you don't need to go through life's issues alone. You know why? Mima cares.